If you've heard a doctor say that peptides don't work orally, what they're really saying is that they haven't read any of the transporter data, the gut peptide literature, or even basic biochemistry in the last 20 years. Because if oral peptides didn't work, then lorazepatide, which inhibits a protein called zonulin in the intestines, wouldn't be able to fix leaky gut. KPV, a fragment from alpha-melanocyte-stimulating hormone, wouldn't even be able to reach the intestine to reduce inflammatory cytokines and modulate the immune system. Collagen peptides wouldn't be able to reduce joint pain in clinical studies, and carnosine and anserine, which are dipeptides contained within meat, wouldn't be able to improve cognition and performance and kidneys and heart and glucose control when taken by mouth in human studies. Yet all of that is documented. And in the case of anserine, being ingested orally by humans, we can even see the blood plasma levels increase. So if any of these experts are saying that peptides don't work orally, then clearly they are not reading the peptide literature. Of course, it depends on the peptide structure, which determines how well it can either resist gastric acid or get broken down by it, and proteolytic enzymes, whose job it is to actually break down certain peptides, and also whether or not a peptide can transport rapidly through transporters known as lat and pept in your stomach and intestines respectively. So if you want to learn more about how to dose peptides, including which ones can be used orally, injected, or even intranasally, then the next step for you is to get Peptide Salvation. It is the largest and most scientifically accurate peptide book ever written, and it covers 112 peptides.